Hi everyone, welcome and thank you for joining us for today's ASA web seminar, Effective Solutions for Medication Management in the Aging Population, which is part of the Empowering Professionals in Aging series presented by Home Instead. We'll be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you'll find information on how to obtain continuing education credit for this event. You'll have 60 days to complete a CE application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you're not logged in directly to this web seminar, that is if you're watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive CE credit, please be sure you log in using the confirmation URL you received after individually registering. If you have questions during the presentation, you can send those at any time using the questions box, and we'll save those for the last 10 to 15 minutes of today's program. Now I'd like to welcome today's presenters. April Ibarra is a gerontologist and strategic partnership manager for Home Instead, and she has more than 25 years experience in healthcare and aging. Kyle Decker is Chief Operating Officer of Simple Meds Pharmacy. He is a member of the Pharmacy Quality Alliance, National Community Pharmacist Association, and Indiana Pharmacist Alliance. Welcome, April and Kyle.
Well, hello and thank you, and welcome, Kyle. So glad you could be here with me on this presentation.
Thanks for having me. Really looking forward to talking about this.
Great. Well, everybody, let's get started. We have so much to talk about, and I just want to thank you all for being here. A physician once said the best medicine for humans is love. And someone asked, what if that doesn't work? And he smiled and said, increase the dose. If only medication management was that easy. As we approach this topic today, let's keep in mind that everything we do as clinicians, providers, caregivers is done with the very best intention to support the older adults, their independence, their health, and their dignity. This topic is complex, and I think Kyle and I could probably spend hours talking with you about it. Unfortunately, we only have an hour, so we're going to get through as much as we can. And I just wanted to thank you for being here to find effective solutions for managing medication adherence. It's a great topic, and here we are. This is, I wish we were all together today, but we're not. But we're going to get through a lot of information, and I think we're going to learn a lot. We have so much to cover, but let's start with the objectives. Let me just go through these quickly so everybody knows what to expect. We want to identify the potential risks associated with medication management. It's real important to start with, why are we talking about this? We want to understand common medication challenges and signs to watch for when meds are to blame for health issues. We want to recognize risks of common conditions that can impact medication management. We want to strengthen the role of the family in reducing the potential for medication risk. We know family, as well as their providers and their clinicians, are so important. It takes a team. And we'll talk a little bit more about resources to help families feel more confident in helping to keep older adults safe and at home. All right, so let's get into the nitty-gritty here. You know, we have to talk about the research in order to really understand the scope of the problem. I get excited about talking about the solutions, but why is this important? Why do we need to address this topic? Over 100,000 seniors in North America ended up in the hospital each year because of medication problems. So it's not so much that, everyone misses a dose of medication every once in a while. I do myself. But it's the impact that medication management has. So that's very important. Home Instead conducted a survey, and we interviewed a random sample of 500 seniors in the United States and Canada to understand better their prescription habits and medication safety. we found that the number of prescription medications increases for the age 70 plus. No surprise, right? But with that also comes a higher risk for potential problems. 20% of those surveyed seniors had some difficulty managing their medications. Does that surprise anybody on this call? Does anybody here take more than 4 medications or have problems? Probably. This is not just an aging issue, but we understand as we age, it does become more complicated. Now, nearly 1 of 5, or 17% of those seniors we surveyed, felt overwhelmed occasionally by taking the medications. And research found that 57% of those surveyed are taking more prescription medications, 4 or more medications on a daily basis, with 20% taking 6 or more. So this is where it starts to get complicated, and it's no surprise. Everybody on this call has experience with it themselves, but take a minute and just think about some of those statistics. This is what we're dealing with. And the mismanagement or all the complexities that go along with their issues with taking medications could really have a severe impact. I think this is one of the most, the one thing that if we can intervene and improve on, it will really improve the outcome for the health for older adults. 1 of 10 seniors unintentionally made a mistake when taking medications, and 11% have experienced a medical issue. So again, this is what we're talking about. It's not just missing a dose every once in a while or getting a little bit confused about the medication. Yeah, we all have problems with that. It's the result of that medication mismanagement and the issue of potential health problems, as well as the fear that what's going to happen if I can't take medications. So I wonder, why are we not talking about this more? What is stopping families from addressing this? And we'll get into more details about that as we go along. At least half of those surveys said they don't have a conversation with their families. Okay, we just talked about that. And most agreed that it is important. So why are older adults reluctant? Now, we've talked about this time and time again. I did a presentation last month talking about planning for aging, and we know that most older adults don't want to burden their family with these things, with anything. And they also, I think, have a fear that somebody's going to think that they can't manage their own health anymore, and then what will happen? Over half, those that do talk about it with their family, they really feel more confident. So I think what we can take away from this is, how do we better encourage older adults to talk about their medication management, to address it with families, to encourage families to talk about it. And they know, seniors understand that their ability to remain independent depends on their ability to manage their medication. So this is why it's important to them. This is probably why they're reluctant. They really want to stay at home, stay independent, not be a burden on their family. But nonetheless, it's important that we talk about it. So let's keep talking about it. A couple of the common medication challenges. This is where it really, as I said before, this is one of the most complex subjects, I think, related to aging. And I wish there was a magic bullet, but there isn't. Medication adherence essentially occurs when a patient takes their medications according to the prescribed dosage, time, frequency, and direction. A breakdown in any of these elements has the potential to result in unanticipated side effects or complications. And, it's not so much they don't want to take their medications, they're doing this intentionally. It's more complicated than that. That's why this makes this a little challenging. So again, I'm very glad that we're talking about it. Those people who are on medications and their ability to control their chronic illness, this is really, really important. Again, it's one of the reasons why we have to address and look at every aspect of the seniors' medication management. So what are the challenges? Why is this a problem? Well, getting timely refills is one. And according to the National Consumers League, 20 to 30% of medication prescriptions are never filled. Now, Kyle and I are sharing this broad subject today. He's going to talk a little bit more about that in a little bit, and also address the impact that COVID has had on this. So, getting those medications, remembering to take medications. The rates of medication adherence drop after 6 months. Half of all patients do not take their medications as prescribed, and adherence is lowest among those patients with chronic illness, those ones we just talked about who are the ones that need it most. The diabetic, the patient with COPD, the patient with heart failure. So that remembering, and again, boy, how do we fix that problem? Again, no magic bullets, but by understanding all of the challenges, we can address them with solutions. Taking too many medications. Many seniors express concerns about taking too many medications, and they're skeptical of why am I taking this? What is it for? What's it going to matter if I don't take it? So the understanding of the purpose of the medications and what they're for is really, really important. Miscommunication. We know that everyone has multiple doctors, and so it's hard to get a big picture of all of the different medications. Now, I think most of you are familiar with an electronic medical record. I have my chart personally, and I went to the doctor the other day, and I thought it was hilarious. They started rattling off all these medications, and I was like, I don't know what that is. I don't know what that is. But they were a variety of things over the last 2 years that I had been prescribed. So if I'm sitting in the doctor's office going, I'm not sure about that, especially because of generic names. Imagine the older adult. Another common challenge is those adverse effects and side effects. Boy, you can hear that in the commercials, right? This medication causes et cetera, et cetera, et cetera. And wow, it almost makes you want to not take medication, but we know that medications really can improve our health. But many people stop taking a medication when they have a side effect. Hey, this one made me feel dizzy, so I just stopped, rather than talking to my physician about that. Those adverse drug reactions make up about 15% of hospitalizations for those 65 and older in the United States, and they can be fatal. So this is important, very important. More common medication challenges. Boy, this one takes another slide because there's so much going on, and it's the fear of asking questions. There's a limited time at the physicians. I think most doctors do the best that they can. I have to say I've seen my personal physician more in the last year than I have in my life, and I'm almost embarrassed when I go in to see her, but she does a great job. But there's only so much time. At the end of it, when the doctor says, "Do you have any questions?" most people are like, "No," because they don't even know what their questions are yet. Or sometimes older adults are just afraid of asking questions. Again, they don't want to be seen as unable to manage. What about the high cost of medications? This could be a presentation in itself. But for those on a limited income, some people have to choose between food and prescriptions. And so, they may not take the medication out of a consequence of the cost. I last year started on a psoriasis medication. I suffered from this for years and years, and finally decided to try a medication. And sticker shock, when I first got the prescription, it was going to be $800 a month. I was shocked. Now, I did a little bit of homework, and I found that I could get that through a discount program, and finally got it manageable. But can the older adults do that? Do they have the time and the resources to kind of coordinate? So family members need to talk. I don't think any family would see this as a burden, but again, older adults simply don't want to bother their families. So families, let's bring it up. Let's talk about it, especially when they're managing 4 or more medications. All right. We're going to turn this over to Kyle because we have to talk a little bit about the COVID-19 impact. Here we are in 2021, still dealing with the impacts of COVID. And so we know that there is a huge impact on medication adherence. So Kyle, I'm going to turn it over to you to go through these next two slides.
Great. Thanks so much, April. That's a lot of good information there. Yeah, let's talk about COVID-19 and how that's impacted medication adherence. First, MediSafe is a digital therapeutics company, and they do medication management solutions. They say that prescription volume has actually dipped below pre-pandemic levels. I guess that's not too surprising, but it's a concerning trend, really, indicating that patients are not taking medications as prescribed or refilling them on time. So ultimately, there's gaps in therapy. Interestingly, this is not consistent across all drug classes. Actually, respiratory and mental health prescriptions have increased, while women's health and ADHD medications have declined. There's also concern growing that prescription volume will continue to drop in 2021 as there's more economic fallout from COVID. This last year, costs led to 29% of Americans not taking their medications as prescribed by the physician. As April mentioned earlier, many patients can no longer afford their medication as a result of the financial concerns from the pandemic. Approximately 5.4 million Americans, so a huge part of our population, have lost their insurance due to being out of work. We know that early in the pandemic, there's a paramount duty to encourage and really optimize patient medication adherence in order to prevent arbitrary treatment discontinuation and consequent disease flare-ups related to increased risk of infection or other effects of disease for patients. According to a study on treatment adherence behaviors during the pandemic in Latin America, over 15% of patients with rheumatic disease suspended their medications during the crisis. Lack of availability was the leading cause at 48%, and fear of the immunosuppressive effect of the medication was the second most common at 25%. Another study was performed in a province in Iran with a very high prevalence of COVID-19 cases. Non-adherence for this study was defined as a greater than 20% change in the dosage or frequency of medication. And what was found was that non-adherence was observed in this study at 6.5% of patients in Iran. NSAIDs and methotrexate were the medications that patients had the highest percentage of non-adherence to. So as we continue to talk about the impact of COVID-19, the pandemic has the potential to negatively impact medication adherence for patients of all ages, not just seniors. So the first thing we'll talk about here is access to care. Establishing care and in turn providing continuous care is difficult during these times, as we know. In addition, access to extra healthcare resources such as caregivers or ride shares are really diminished for various reasons. For example, they don't want to be exposed or potentially exposed to the virus, or the rideshare company is struggling to keep up with demand, those sorts of things. Also, geographic areas that were already had limited number of providers or pharmacy access, they're seeing a decrease in patient visits overall, which leads to fewer medications being prescribed and refilled, and ultimately, the patients taking the medication. So access to care has been impacted by the virus and could lead to decreased medication adherence. The next one, which we've all felt, the shelter in place. Many patients, especially those with chronic conditions, are sheltering in place to protect themselves, which is great, but this has caused many of us to neglect our health. Patients are going out in the public less and limiting themselves to receiving health care. And due to shelter in place, virtual visits, telehealth, those sorts of things have become a staple in healthcare. And many find that a barrier due to reasons such as technology, access to technology, or literacy. And similar to limited access to care, there are fewer medications being prescribed and refilled due to the shelter in place, which directly decreases medication adherence. The next one is economic concerns and barriers. We all know that cost prior to COVID was a huge barrier to patients in receiving their medications, but now due to COVID, countless layoffs, unemployment numbers on the rise, et cetera, causes many not to be able to afford their medications. Some patients are likely, as April mentioned, only spending money on necessities such as food or their home, and therefore neglecting their medications, not taking them, which directly decreases adherence. And then the next one here is delivered medications. Mail order pharmacy, as some call it. While this can be a solution for some patients, sheltering in place, it can be a barrier for others. Not being able to get out to the mailbox or answer the door because they have immobile conditions or physical limitations really decreases, medication adherence. So what I would say here is just reinforce the importance of proper medication management during COVID. A person's health should always be a holistic approach, but even more so during this COVID-19 pandemic that is, hopefully a once-in-a-lifetime thing that we're going through here. The virus is known to affect those with chronic conditions worse, so it's very, very important for patients with chronic disease states to maintain good health, good diet, exercise in order to stay out of healthcare settings or the hospital, where if they have to go to those places, they potentially, increase the exposure or risk to being exposed to the virus. Keeping the number of hospitalizations and admissions down has been a focus throughout the pandemic, and keeping those with comorbid conditions healthier supports that focus going forward.
Wow.
And that's, yeah, pretty astonishing
goodness.
stuff that we're going through right now, April.
It really is. I think sometimes it's moments like this where I sort of get this overwhelming sense of being in the middle of it. Day by day, we're all getting up, doing the best we can, but also recognizing the phenomenal impact that this is having on everyone. So thank you for Kyle. That's great information, and some of it not surprising, including the mental health components and the different challenges. So again, we have no magic bullets today, but I think by talking about it, by breaking things down, understanding the complications and some of the barriers, we can make a little bit of difference, definitely. Let's talk about the 10 warning signs that meds are to blame for health issues. And I think this is important as well. Distinguishing between a medication side effect or reaction and an illness is a process that's best left up to medical professionals. Dr. Jane Potter is a geriatrician and director of Home Instead Center for Successful Aging at the University of Nebraska Medical Center. And she says it's always important to check with a doctor before drawing any conclusions. But she also identified 10 signs of potential problems that could result from medication mismanagement or side effects. And I thought we'd share these. We'll go through these pretty quickly. We do have a lot to talk about. A new symptom. That's a sign such as dizziness or nausea that could be a medication side effect. I've mentioned that I'm on a psoriasis medication, had to go through the specialty pharmacy. They just changed it to a new medication. And interestingly enough, after I had my first dose, I've had 3 weeks of, I'll say it, COVID-like symptoms. I actually went last week and got a COVID test. It came back negative, but I had to look and say, okay, the only thing that's different in my life is this medication. Could I have these feelings, this headache, this, nausea to a degree, some of these other things, could that be related? So you have to think about that. So a new symptom that is prevalent after starting a new medication is something to be aware about. Changing appearance. If there's something in the physical self that looks different, changes his skin tone, color, fatigue, fluid retention, always seek out the cause of any change or in appearance with your physician. Full bottles. Again, this full pill bottles. If a medication bottle is full, that means the older adult or the client is not taking it. That's a sign that we need to address that. And we need to understand, why. So there's so much we can do in observing. But as I say that, we don't necessarily have the ability now to observe like we used to. So that makes it even more challenging. Another thing to observe is mobility issues. Dizziness and lightheadedness, again, are common side effects for several types of medication, and they could impact the person's mobility. So if all of a sudden you're seeing, your family or your clients have a change in mobility, let's check to see, is there something different? Is there a new medication that could be causing it? Talk with the physician and let's get this addressed. Perhaps change the medication, change the dosage, change something. Any changes in thinking, reasoning, or mental acuity, these are big signs. And we have a tendency often to think of someone who's older and think, wow, mom's really, she's declining mentally. How do we know it's not the medication? So these are all things to think about. Kind of going back to the mobility, same thing, difficulty in performing activities of daily living. Let's not just assume our clients or our families are declining. Let's see, could this be related to a potential side effect from the medication? Trouble sleeping. Somebody's been normally a great sleeper, all of a sudden they're having trouble sleeping. Why is that? And I say a new medication, but, I suspect, and I'm not the pharmacist here, I'm the gerontologist, but I suspect if any of these things happen, it could be on medications they've been on for quite some time. And sometimes the body starts to metabolize and change things differently, or perhaps, there's just a change in that individual's way they're taking that medication that could create these warning signs. Change in appetite. Boy, I notice when I have a change in appetite, I don't know about you, and that's a problem. If a medication is impacting the older adult's ability or desire to eat, that's going to cause further problems. So we can start to see how all of these really play such an important role in keeping that older adult safe, active, well, independent. And again, just difficulty maintaining their home. That could be, they just don't want to do that anymore, or it could be, some of these things related to the side effects of the medication. And just in general, observing their overall well-being. Sometimes, medications can cause depression, can cause anxiety. Let's observe those. Let's be aware and address them as they come up. We've talked a little bit about chronic conditions, and this is very important because, as we mentioned earlier, it's as people, with chronic conditions tend to not take their medications as well, they're going to be impacted. Their entire scope of their aging experience is going to be impacted. So I want to go over the risks, but and what to be on the lookout and some possible solutions for some of these common chronic conditions. So let's talk about arthritis. The risk is there's over 100 different types of arthritis-related conditions, and out of 5 U.S. adults has arthritis. And oftentimes, what does that mean? They're taking multiple medications for that pain. Nothing worse than chronic pain trying to be managed. So what we want to be on the lookout for some seniors is on those non-steroidal, oh God, I can't even talk on this one, those NSAIDs, those anti-inflammatory drugs. They could lead to stomach problems. I'm one of those people who, if I have pain and I take pain for, it helps, but then I have the stomach problems. But it can also cause heart problems and kidney damage. So that's something we want to be on the lookout. The solution could be the pain of arthritis can prompt the individual with this condition to look for any solution to ease the suffering. So be aware, look at the side effects, and talk about some different options that may not be readily available now, but water exercise, I think, is one of the most beautiful things that people with arthritis, or really anyone, can do. Physical therapy, topical rubs, heat and cold packs, anything for relief to help them. And, we're talking about medication, but Kyle mentioned earlier too, just the concept of trying to take better care of ourselves. Taking time to do something positive for yourself. Taking the medication is important, but also, are we exercising? Are we eating well? Are we managing our stress? This is a stressful time. So look at the wellness side of things as well as managing those medications. COPD. This is a chronic inflammatory lung disease, and it causes shortness of breath and coughing. So these people are at very high risk. We want to be on the lookout for weight gain, any diagnosis of diabetes, osteoporosis, cataracts, or infections. And some medications carry risks, such as a fast heartbeat or shakiness. A solution, someone with COPD should remain under very close doctor supervision, since a change in the medication can really cause some problems. So be sure to keep good records of the medications and when they should be taken. So this is one, again, that we need to manage very closely. Diabetes. The risk for diabetics, insulin and oral drugs are among the top 4 drugs used to treat diabetes. Used alone or together, they account for 2/3 of emergency hospitalizations, according to the CDC. So we want to be on the lookout for side effects of using these medications that can run the gamut from nausea, diarrhea, to cold and flu symptoms. And that's a problem now. As I mentioned before, it's like, I've had these kind of symptoms and now we're in times of COVID. So we have to ask ourselves, what is this symptom and how seriously should I take this? Heart disease. Every 43 seconds, someone in the United States has a heart attack. All of these chronic conditions and problems that have not gone away, but that are not really top of mind now because of COVID, are still there. So we need to be on the lookout because treatments for every heart disease can vary considerably, and risk could be developed when different medications are used. So again, this is an important thing to kind of take a look at. A solution: someone on heart medication should check with their doctor anytime a different medication is added or removed. And you want to, of course, manage that condition with a good lifestyle, with weight management, stress management, proper nutrition. I've often mentioned that I have a bias because, my background is aging and wellness. And, I see a little bit of everything now. Some people who are realizing, wow, I need to take better care of myself. But I also see on the flip side that people are like, wow, the comfort that I get at the end of the day is, give me that biscuit, give me that those French fries, give me something that's going to cheer me up. So we got to find a balance, right? Strokes. Wow. I used to manage a stroke support group, and I have such high regard for people who have survived strokes. It's the 5th leading cause of death and a leading cause of disability in the United States, according to the American Stroke Association. So we want to be on the lookout with this one as far as missing medications, and that could cause blood pressure to go up and creating a higher risk. So the solution: make sure that 80% of strokes could be prevented. So we need to keep them on their medication, doing all those treatments that they have, and talking frequently with their physician. So a lot going on with chronic conditions, no surprise, but we also have to talk about the cognitive issues and mental health conditions. Alzheimer's. While there is currently no cure for Alzheimer's, medication can help to slow the increase in symptoms of Alzheimer's, such as memory loss, confusion, and problems with thinking and reasoning. As the disease progresses, those living with dementia may experience more medication issues. And what is the risk there? Most mental health experts agree that when depression is severe enough to impact the ability to function in life, medication can be helpful, even life-saving. However, studies have shown that antidepressants can increase the risk of falls, fractures, and bones, right? So we know on one side the medication can help us with a particular disease, but it's going to have risks and side effects. So we want to be on the lookout for those side effects, consult with the physician about whether an antidepressant is the correct solution, and just kind of look for symptoms such as crying, restlessness, fatigue, aches, anxiety, depression. This is a tough one now. It really is a tough one. I think everyone is struggling. Until a few years ago, anxiety disorders were believed to decline with age, but experts now recognize that anxiety is as common among older adults as it is among the young. And I'm not surprised by that, quite frankly. It's important to ensure that a medication is at the right dose and not adversely interacting with other medications. So this, it's a lot of information in a short period of time for that particular talking about this chronic health and mental health. But we have to just remember everything impacts the other. So the medications can really help with one thing, but it may cause a problem on the other side. And that's why we really need to be openly talking about and observing any changes in the senior. All right. Let's talk about tips for medication and dementia. I'll spend a little bit of time on this because obviously it is a challenge to, someone with dementia also has diabetes. They could also be a stroke survivor. So any flat out refusal to take medication, it's really all we can do is take the best approach. Dementia affects everyone a little bit differently. However, dementia is a progressive disease that will eventually require that the person has assistance with all their activities of daily living, including medication management. So when talking with a person with dementia in the moderate to late stages, always be sure to make eye contact so that you know you're talking specifically to them. Approach them from the front so that they can see you coming. I mean, these are such common sense things, but we have to slow down and be present with them. If they are sitting in a wheelchair, it's helpful to get down on their level and talk directly and give them time to respond. For some of them, it takes a little longer to process the words that they're hearing. So give them, a few seconds to respond. And if that person really refuses to take their medications, just remain calm. Don't get frustrated. It only escalates the situation for you and for them. Just redirect and come back later. Explain what you're doing before you do it. This can help ease any confusion and be descriptive. We're gonna take that big round yellow pill or that big white pill and demonstrate. I'm gonna put this pill in your mouth. Are you ready? So using those approaches that you would for any communication with someone with dementia, and don't argue with the person. Sometimes it's easier just to take the blame and just say, hey, this is my fault, but I want to help you with this, and just pause a little bit to emphasize what you're saying and give them a moment to respond. So we're going to switch gears now and turn it back over to Kyle to talk about avoiding common medication mistakes. Kyle?
Perfect. Thanks, April. So yeah, let's talk about avoiding medication mistakes. But first, let's do just a real quick sample case study. So I'm going to read this. Consider 92-year-old Fred, who lives in an independent care community and is usually very skilled at managing all of his medications. After a bout with congestive heart failure, he was prescribed a diuretic to help eliminate fluid from his system. It worked, and Fred got better. So what did he do? He stopped taking the medication. There was one pill less that he had to take, and he had to remember to take, and he viewed that as a temporary medication, when the doctor actually intended for him to continue taking the medication. So what was the result? Soon after stopping the medication, the fluid began to build up again, and Fred was right back in the hospital. So what do we know about this? We know that medication management uncertainty puts seniors at risk for medical issues or emergency issues due to incorrect dosage or adverse medication interactions. And as April mentioned earlier, 100,000 emergency hospitalizations take place every year for patients 65 and older in the U.S. So some things that we can do to help with that, again, from Dr. Jane Potter. The first thing is to get a pill organization system or service. About half of patients do not take their prescriptions as prescribed, which is just, as a pharmacist, a very troubling statistic. And that's according to a 2011 study, Medication Adherence from WHO Cares. That's why pill organizers can be such an important tool. Other things that are available out there are services such as Simple Meds, where the pharmacy will pouch package in multi-dose packets all of the patient's medications, vitamins, supplements, etc., and the correct date and time of day that the patient should be taking them. So that's another option out there. The second one is to make one doctor the gatekeeper to all medications for a patient. As we know, it's typical for adults to have, or older adults to have multiple disease states, and as a result, multiple doctors. This can potentially be dangerous, though, and Dr. Potter actually advises that you designate the primary care physician as the gatekeeper. I know early on in my career, I just assumed that doctors talk to one another about an individual's care, but we can't make that assumption because it doesn't always happen. In fact, I would say it likely doesn't happen unless you prompt it to. Because of that, it's best to always keep a list of all the patient's medications and who is managing what medication up to date, and take that to the doctor's visit every time you go. The next one is to know why your loved one's taking a medication. What specific condition or symptom is the medication being prescribed to alleviate? Make sure the senior can read and understand the medication's instructions. That's the first barrier, is having them understand and how to take them. And you can have your pharmacist, assist with that as well. And then double check with your pharmacist to make sure that medications won't interact with one another. I think people just assume that that's being done, but if all the medications, including over-the-counter supplements, minerals, those sorts of things aren't on the patient's profile, then the pharmacist won't know. The next one is call the doctor about any changes and how your senior's thinking, feeling, or looking. And April hit on this a bit earlier. Many people have the best sense of when they feel different, and this is typically after a change in medication. It could be a total change, it could be a dosage change, a directions change, and make sure to bring these types of things immediately to your healthcare provider. And then the last one on this topic is keep regularly scheduled appointments and an open dialogue with your loved one's healthcare provider. Encourage your loved one to keep regularly scheduled appointments and open communication to avoid medication problems. Consider writing down questions in advance so that you have everything at your fingertips when you're actually there with the provider. A lot of people feel like they're taking too much of the doctor's time, when in actuality, if you have everything prepared, you can really get exactly what you need out of the appointment. The next thing is medications and hospital discharge. Although seniors take regular medications, a recent hospital stay oftentimes results in new or unfamiliar prescriptions. So taking the right medication at the right time and the right dosage is important. Review the list of all medications to ensure compatibility, as we talked about previously, and consult their primary care doctor, because existing prescriptions that the patients are taking prior to hospitalizations, plus new medications being prescribed by the discharging physician, and over-the-counter supplements all have to be reviewed or analyzed upon discharge to make sure what was being prescribed upon discharge doesn't overlap with something that the patient was taking prior to the hospitalization. So you really want to make sure that you nail that down upon discharge. What should be taken long-term, what should be taken long-term, and what should be discontinued or continued prior to being admitted to the hospital. Picking up over-the-counter medications and prescriptions from the pharmacy and ensuring medication is taken when it's prescribed is important. The twice-a-day medication shouldn't be taken all at once. That can lead to really bad consequences, but you'd be surprised how many people think that it's okay to do that if I take it all in one day. Organized pill to ensure confusion doesn't lead to a medication mishap. We talked about that a bit earlier. Document and track to ensure medication is taken as directed. I think that that's important as well, because we all know that I don't remember what I had for breakfast yesterday morning, let alone if I took my medication, those sorts of scenarios. And then lastly, watch and take note of any reactions or side effects to the medication, which April hit on a bit earlier. We know our bodies the best, and when something doesn't feel right, where there's smoke, there's a fire. So make sure that we're always addressing those. Next, we're going to hit quickly on opioid use and misuse. This is a pretty hot topic, a much more hot topic prior to COVID, but it's still very prevalent. Hospitalization rates for geriatric misuse of opioids has quadrupled in the past 20 years. By last year, over 5 million older adults have substance abuse problems, and 1 in 4 adults have filled an opioid in the past 2 years, which is a pretty high number. We're starting to see those numbers come down with reclassification of certain controlled medications, like hydrocodone is now a Schedule II rather than a Schedule III, so it's not being prescribed as much, but there are still a ton of controlled prescriptions being filled, and we just need to pay attention and be cognizant of what they're being treated for, and they're only being used for a short period of time, if at all possible. 40% of older adults have chronic pain that's often treated with opioids, and age is a risk factor for opioid overdose because the body just doesn't as efficiently process those medications or metabolize them, so they stay in the body longer and can result in those opioid overdoses. And the last thing here is older adults are 4 to 5 times more likely to fall than those taking NSAIDs, just because they're so they affect the body so much more broadly than an NSAID. You get dizziness, confusion, balance issues, those sorts of things. So you want to be very careful with that. So what do we do? So opioid tips and avoiding misuse. The first thing is to consider non-opioid pain management. So we talked about NSAIDs, non-steroidal anti-inflammatory drugs. Tylenol and Advil or ibuprofen are the most common. You can also look at cognitive behavioral therapy, medication for depression or for seizures. You want to keep an eye on those. Exercise therapy, which we talked about earlier, just doing the right thing for your body. Exercise and weight loss, or other therapies such as acupuncture and massage has actually shown really good results. So consider those as well. Understand expectations of pain management. It's very important to have a pain management goal and develop a treatment plan. And oftentimes that needs to be with your prescriber. And you as the patient or your loved one as the patient needs to assess the risks and benefits of prescription opioids. Is it worth it? Is the pain severe enough that I actually need an opioid? Follow up if pain is not resolving as quickly as expected. Maybe there's another underlying issue that needs to be addressed. And do your research to find state prescription drug monitoring program information. It's very helpful to know a patient's prescription history. And I'm not suggesting that everyone is drug seeking. But as a pharmacist, we do see that from time to time where patients will doctor hop, they'll pay cash for prescriptions. So you just want to be cognizant of whether or not they're drug seeking or not. Work with your doctor to create a plan and follow up regularly. Know options about non-opioids to manage pain. Talk to the doctor about side effects and concerns that you have with taking an opioid, and just making a very informed decision with your doctor. The next thing is to take and store opioids properly. Never take greater amounts than what's prescribed or more frequently than prescribed, and never sell or share prescriptions with anyone. It's actually illegal to do that and is punishable. So we want to make sure that that's never the case. And store in a secure place out of reach of others, especially children, because the results could be catastrophic if they get their hands on those pills. Dispose of unused prescription opioids at the end of your treatment. Don't keep them and hold on to them because that just opens up risk for other things that could take place. And lastly, and maybe most important, if you do take an opioid, make sure you evaluate what you're taking with it. So you want to avoid alcohol and any other medications such as, it's a long word, but benzodiazepines. People most commonly know those as Xanax or Valium. You don't want to take them with muscle relaxants because they actually compound one another. So Flexeril or cyclobenzaprine, you want to avoid those, as well as hypnotics like Ambien or Lunesta, and other prescription opioids. You don't want to take those together. Next, let's talk about it's simple, which is simplify regimen, impart knowledge, modify patient beliefs, provide communication, leave the bias, and evaluate adherence. So let's go through each one of these quickly. Simplify regimen. The more simple a patient's drug regimen is, it's plain and simple. They're more likely to stay compliant and have less issues. So, for example, prescribing extended release dosage forms rather than immediate release dosage forms where you have to take them multiple times a day. That's number one step. You want to do that first, simplify the regimen. Also, you want to take into consideration small oral solids rather than large pills, or what the layperson will call horse pills. We see those with potassium chloride. The pills are just huge, but they make very small ones as well. So that's an option. The next one is to impart knowledge. Patients need to understand why they're taking the medication and why it's important for their health. We know it's a fact that when seniors know why they're taking a medication, they're more likely to take it and results in higher compliance. Modify patient beliefs and behaviors. Some patients may not believe it's important to take their medications as prescribed, so talk to them about that. Use packaging or other assistive devices to make it easier for them to remain compliant and improve health outcomes. Other patients, I think about my grandmother so often, because I would go to her house to visit her and she would have pills just laying on the floor, and they would be, "Grandma, why are you not taking your medications?" And they're of that generation that just didn't feel like it was very important. Provide communication and trust. I always say over-communicate. Effective communication leads to better health outcomes. When both the patient and the provider are on the same page, the patient trusts that their health is in good hands. So talk to your patients in clear terms and avoid health care terms that may cause confusion. Leave the bias. Most of the time, patients want to do the right thing, and they want to take their prescriptions as they should. They may feel overwhelmed about the number of medications or not fully understanding the direction. So, don't quote unquote judge them. Just leave the bias. And then lastly, evaluate adherence. If patient symptoms or health, as April mentioned earlier, doesn't seem to be improving after an adequate time period, then evaluate what's going on. And that may be the point in time where you need to bring in the prescriber. Let's talk now about safe drug disposal. I mentioned earlier about storing medications, specifically opioids, in a secure location. So what do you do when you're done taking them? So you can dispose of them in household trash. This little graphic here will show you, I guess, you want to mix the medications in unpalatable substance such as dirt or cat litter or coffee grounds. Put that in a sealed plastic bag with the medications and throw it in the trash. It's also important to scratch out or remove any label information with your name on it before you do that, so that nobody gets their hands on that information of yours. You can also flush medications down the toilet, although there's been some controversy about that, what you can and can't flush down the toilet, but take a look on the FDA's website on what you can and cannot flush. Oftentimes, hospice companies will dispose of medications for you, and also pharmacies and police stations, as a matter of fact, have drug take-back days where you can take medications and they'll dispose of them for you safely. And now I'm going to turn it back over to April.
Thank you, Kyle. Wow, I tell you, there is so much to talk about, and I feel like we've just kind of stirred up the hornet's nest and really covered a lot of things, but it all does come back to the communication. Everyone on this call has an opportunity to try to make an improvement in our families, our clients, those people that we care about who are managing their medication. And remember, it's important to remain positive, be empathetic, listen, and they are. This bottom statement, make the patient feel a part of the solution. The patient is the solution. So whatever we can do to help them and to make the right decision and to do the best. And I think, again, there's a desire to be compliant, but it's so complicated. I found a quote this morning. I thought this was interesting, and it was about conflict. It made me think about this, and I'm going to share it with you. Conflict is frequently motivated by unspoken needs that are masked by confrontational attitudes or aggressive behavior. When we come at conflict with love and acceptance in our heart, we empower ourselves to discover a means to attaining a collective resolution. So, if you are dealing with a family member, so many of these things we can't change. We can't change if someone doesn't have the money, if they don't have access. Those are bigger issues. But when we're just dealing with our own loved ones or our clients, if we can really stop to think about why are they so resistant to taking these medications, understand that there's meaning behind that behavior. And we can make a big difference. We can't, change everything, but we can make a big difference. I realize we have 5 minutes left. We've gone through so much, Kyle. You are such an amazing resource, and I'm just so glad everyone was here today. Let me look through some of these questions here and see what we can tackle in the next few minutes. And just know that our contact information is available in the slides. If we did not get to your question or you would like to discuss something, please reach out. We'd love to help you. Let me see here. Any suggestions for medication compliancy for mentally ill patients who live independently besides charting or behavioral contract? Kyle, I'm going to let you see if you have any thoughts on that one.
Yeah.
Challenge.
I would first, as we mentioned earlier, make sure that you have a really good organizational process for managing those medications, and routinely, frequently, chronically check up on them and make sure that the medications are being handled appropriately. I guess that's where I would start. April, I don't know if you have other thoughts.
I don't. I think that's a challenge. And I think really everything we talked about can apply in terms of our efforts, to understand, to be empathetic, to communicate, I think can apply as well. I think, it's the best I can offer there. How often should medications be reviewed in the very, very old, like over 80? That's a good question. I'm going to let you tackle that one.
Yeah, I would review them at every doctor's visit. With your physician, have a complete list of all the medications, directions, dosage, and doctors that are prescribing them. Review those with the primary care physician any visit. And then on a monthly basis, it depends on if the patient's getting a 30 or a 90-day supply. We see with mail order a lot of 90-day supplies. But anytime you receive new prescriptions, or I should say new prescriptions are dispensed to you, you need to take a look and just make sure that it's correct. It's bad to say, but mistakes do happen, even at the pharmacist level. So you always want to make sure every month that you're taking a look at what you're taking and putting into your body. Yeah.
I know I take a lot of generics, and every time that I get them, they're a different color and a different size and a different shape, and even that confuses me, so that's good. And thank you for advancing the slide there. I realize I did not do slide 23, which is in your handouts, which is a bunch of resources, because obviously we could not begin to cover everything today. But let me continue to look here. Somebody suggested a resource. I'll just mention this. Dr. Leslie Kernison's list of medications to avoid if you're worried about memory, betterhealthwhileaging.net. That's a good recommendation. Let me keep looking here. As a caregiver, I have noticed that if an RX is autofilled but changed by a doctor, the patient will forget to let the pharmacy know and take the meds not needed. It's just a kind of a comment there. Doesn't disposal depend on regulation of locale? I think you did mention that. So you got to know what's going on in your area. And then I believe somebody asked about, a question is related to what resources are available to help aging seniors understand exactly what they are taking. And she provides an example. One thing I do to help my mom is create a visual guide with pictures of the pill, dose and frequency, and time to take the medication, and the purpose of the pill as she prints that out. I think that's great. Again, this goes to communication, to customizing it. Your loved one and how they, how they respond and how they learn. So I think that's great. So I believe there's one more question. I'll get that in here. What is your opinion on Seroquel? You can tell I'm not the pharmacist because I can't pronounce anything. Seroquel and Risperdal?
Yeah, so those are used oftentimes for cognitive issues or depression. Sometimes there's several off-label uses. And what I will say is that while some medications have what we call in the pharmacy world a more significant side effect profile, those drugs exist for a reason. And oftentimes I'll tell my patients that you need to weigh the risk of the risk versus the benefit. You know, there are some really great drugs, but for some people they just can't take them. And so I would say with, you know, Risperdal and Seroquel, there are more side effects associated with them compared to other medications, but sometimes those are the only meds that will work for that individual. So always weigh the risk and benefit.
Yeah, I think that's important. I think we all have to do that with any medications that we take regardless of age. So I think that's a great way to close out our session today. I want to thank you, Kyle, so much for your fabulous insights and knowledge, and thank each and every one of you today on this call for joining us and to being a part of this solution, helping your families and your clients to manage medications and age as well as they can. So thank you, everyone, and thank you, ASA, for hosting us. Have a great day.
Thanks so much, April and Kyle. This is a great presentation.
Thank you.
Great job, April. Thanks for having me.
Thrilled you could make it.
If you'd like to claim CEUs for today's web seminar, you'll receive a follow-up email by the end of the business day that will contain a link to the CEU application. That email will also contain a link to today's slides. You'll have 60 days to claim CEUs for this event, and it will take 30 days from the date of your submission in order for us to process and issue your CE credit. Thank you, everyone. Have a great rest of your day.